Patients of Reddit, what happened when a doctor or nurse accused you of faking it when you were actually in need of urgent medical care? My friend's dad went to the ER and the doctor said he was fine after minimal examination. Her dad insisted something was wrong and said he wouldn't leave until they ran some tests. As he was being escorted out by security, he had a brain aneurysm and died. Her family was awarded a pretty massive malpractice settlement, but they were absolutely devastated. I fell down a flight of stairs one time while working, hit a nail on the way down and ripped my forearm open and was bleeding a good bit. Adrenaline had me going long enough for my girlfriend, a nurse at another hospital, to drive me there. I had a bloody paper towel on my arm and all the security guards and nurses assumed I was a junkie that blew a vein. Finally all the hype wore off and I kinda passed out and woke up in a wheelchair in the exam room. I don't know exactly what happened but my girlfriend was flipping crap on the workers. She said half of them assumed I was on drugs and the other half thought I was faking it to skip the line. I wasn't dying of blood loss or anything. I just got woozy when I actually was able to see the meat in my arm for the first time. They all just watched me as I fell to the floor and busted my head on the floor. Even then they didn't do anything. My girlfriend, who's not even half my size as I'm not a small guy at all, had to pick me up and drag me into the wheelchair. Frick that hospital. Yeah, my mom watched an old lady die from blood loss in an ER a couple decades ago. She just nodded off and collapsed and the nurses didn't do anything for hours. My mom tried to yell at them to do something but this was before she had learned English so nothing came of it. Not as a patient but as a parent of a patient. My wife and I started to suspect that something was wrong with our son starting at age 2. He would run around all day and was an active little guy but never sweat. He also never appeared to get cold. We live in New England and he would often take his shirt off before going to sleep even in the winter months. These concerns were dismissed as a toddler's or weird sort of thing by his doctor. We later noticed that he would stop and complain about his hands or feet hurting while playing or laying in bed. These were also dismissed. We were told that the pain in his feet could be because his feet are flat or because of growing pains. We were told that it could also be attention related. The doctor said that it's not uncommon for middle children to act out. This continued for 4 years. My sister is a biologist and asked us if we ever got him checked for Fabry disease. I flat out asked the doctor if he could be tested and the doctor told us that there was no way this was Fabry and they weren't going to test a kid without any genetic history of the disorder. The disorder is genetic and without a classic sign. One that often doesn't show up until adulthood, if it shows up at all. We waited until our son was literally screaming in bed about his hands and feet feeling like they were on fire. We demanded to get him tested and he was diagnosed with Fabry. It's essentially a metabolic disorder caused by a missing enzyme. There are many issues associated with it but the main one is extreme neuropathic pain in the hands and feet. The pain can be random but with my son it is normally because he overheated since he lacks the ability to sweat. He plays sports so we have to be careful. Overactivity and fevers have to be watched out for since his body can't cool itself down. Pain can last anywhere from a couple of minutes to a couple of days. The average age of diagnosis for this disorder is around 16 so it's not surprising that his doctor missed it. Most doctors do since it's a rare disorder. That was a little over a year ago and my son is doing well now. There is no cure but treatment allows him to live a relatively normal life just with some added pain. I couldn't imagine making him wait until his teens to get any relief. I know someone with this. He borrowed my ex-husband's cooling vest from Glacier Tech, ex-Hazmes, some symptoms brought on by heat, last year to see if it helped and wound up ordering 2 for intense days. It might be worth a check. I was in labor and because it was my first, they acted like I had no idea what was happening and kept denying what I was insisting. I was over 2 months early and handled pain so well. They acted like it was just in my head. Made me stand at the counter filling out paperwork while I insisted I needed to push. They decided to lay me down to check if I had even started dilating, and I promptly pushed him out. I was furious with how I was treated. I still am. Same here. Well, they wanted me to wait for the doctor. Finally I just started screaming and pushing. They all finally rushed in to help me. My mother had a stroke at age 32. The doctors didn't diagnose it properly for over 24 hours because they were convinced her symptoms must have been related to drugs since she was in good health and so young. My dad apparently tried to tell them that she has no history of drug use, but they didn't believe him. Now she's permanently disabled because of how long it took for her to receive proper treatment. Not me, but my mother. She had called an ambulance because she had been experiencing chest pains, to which they basically told her she was crazy. About a month later, she passed away from a heart attack. That sucks, especially since doctors consider chest pains an emergency. Sorry for your loss. When I was in labor, the hospital had my records wrong and showed I was due a month later. I was pissed, especially since I was in labor and in a lot of pain. The lady kept arguing until she realized I was in labor. She must have heard all the crap my boyfriend, now husband, we're talking about her. Because nobody has ever gone into early labor. Was 12 years old and had a heart problem that was just starting to show. Arrhythmia and palpitations. Only happened when overexerting myself. Go to cardiologist and was accused of faking it to get out of chores and soccer practice. By the time I'm 15, my heart is absolutely unreliable throughout the day. During an attack I would lose my sight and pass out. Same cardiologist still claimed I was faking it. Kids just don't have heart conditions. 16 years old and my heart finally stops. Luckily I passed out earlier at school and was in the nurse's office when my heart stopped after another episode. Woke up in the hospital, and BTW had a heart deformation that required surgery. My mother blew her lid, according my doctor of wanting to see me dead. Went to his office and threw his degrees and awards off his wall at him and was screaming at him. Only reason she didn't sue was to prevent assault charges. Simple echocardiograph showed growth causing the electricity to pump my heart to go in circles. It wasn't fun having heart attack simulations nearly every day for 4 years. Before anyone asks, was poor and that cardiologist was the only one on my mother's insurance. To my doctor's credit, we both kind of had a laugh at this one before the test results came back. I went to my primary because I'd been experiencing hot flashes. Doctor, Google couldn't tell me what was wrong, and I knew it didn't feel right. Well, at least we know it isn't menopause, my doctor joked. I laughed. What 23-year-old woman spontaneously goes through menopause? This one. My doctor was very apologetic. My mom went through full menopause at 36 and it turned out it was caused in part by Hashimoto's, which they also didn't know she had until she was in her 60s. I'm glad your doctor did tests and helped you. Changing it up just a little, my colleagues were convinced a girl was just faking a stomach ache. She was about 16 years old and it was exam season, a time when we would get many sudden tummy aches, fits, etc. So I understood their skepticism, but something didn't sit right with me. I took her history myself and sent her for an emergency ultrasound of her abdomen. Ectopic pregnancy. It was ready to rupture at any moment, so I shipped her over to Obs-Gyn to get surgery ASAP. She came out just fine, but man oh man did I give my co-workers a hard time after that. Exam season or not, we need to be thorough. Had another time when it was just me and one other doctor working admission. She dismissed a case of a little girl faking fatigue for attention. Thankfully I overheard her telling someone, so I went to double check. The poor girl was having a carpopedal spasm and was most definitely not faking her condition. He hooked her up to some calcium and sent her home with meds the next day. I'm not trying to make it sound like I am perfect, but in our line of work we must always be a little paranoid. Thank you for being conscientious, thorough, and taking your oath seriously. It truly is the difference between life and death. Not my child, my brother. He was 11 and suddenly tired and lethargic. He missed a lot of school. He hated missing school. My mom kept taking him in and they'd say it's the flu, or puberty, or mono, and it wouldn't ever get better. After a few weeks of this, my mom brought him to the hospital again and yelled at his doctors that something was seriously wrong with her son, and they needed to do their jobs and figure out what it was. It was leukemia. They called the next morning just before 2 AM and said the tests came back. Your son needs to come in now. Not in the morning, right now. I can't imagine what happens to a parent in that moment, when you know it's bad because they call you in at 2 AM. but you don't know why. He was in treatment for just over a year and was re-diagnosed on his birthday. A few months later, he had a bone marrow transplant and was able to come home pretty quickly. There were complications from the transplant, called graft versus host disease, like organ rejection, but the new cells try to reject you. It attacked his musculoskeletal system, causing stiffness and some dangerous situations. This October will be 8 years since the transplant, and he's cancer free. That boy loves to use the cancer card now, but he definitely earned the right. A doctor didn't believe me when I had a kidney stone that was too big to pass. He only changed his mind when another doctor checked me and started freaking out since I was getting super sick from the stuck stone. The doctor ended up getting fired from the hospital and my parents sued him. I wouldn't call it urgent medical care, but I was stuck in my room for about 5 hours on my bed with my head pressed into my shoulder because I had a pinched nerve. I had never had one before. I wasn't able to move my head at all, and when my mom got home from work she called an ambulance for me. They carried me out in a sitting position and off to the hospital we went. When we got there, it took about a half hour for me to get into the hospital bed, and ended up just giving up and leaving me sitting upright. The doctor pulled my mom out of the room and asked if I had a history of faking injuries in order to get painkillers, because I was pressing against the pain instead of leaning my head away from it. Whenever I get cluster headaches I find that counter pressure against the pain feels better than none. Had people questioning if I was really in pain or not. When I was 16, I was in a really dark place and one day I decided to confide to my doctor that I thought I might be depressed and see what he would recommended. Dude straight up laughed in my face and said, "You're not depressed, you're just a teenager." I told my mom I wanted to change doctors after that and it took another year and tons of self-destructive behavior before I saw. Same thing happened to me. I begged for help at 15. Got told I was an overdramatic teenage girl that just wanted attention despite how intense my mood swings were and the suicide attempts. Never asked for help again until I had a 4-month depressive episode at 22. Turns out I'm bipolar too. This is not as serious or urgent a condition as the others, but it still manages to raise my blood pressure years later. Starting from when I was about 7 I would have terrible stomach pains, which my pediatrician claimed was attention-seeking behavior. He told my parents that they should punish me anytime I complained of stomach problems. My parents, who love yelling, jumped at a new reason to scream at me on a nearly daily basis. When I went to college I was finally diagnosed as having a hiatal hernia, just like my grandparents, father, and aunt. When I was a kid they even commented that I had the same symptoms they did, which for my pediatrician meant that I was just mimicking their complaints and didn't have the same condition. Because it had been untreated for so long I now have to worry about Barrett's and esophageal cancer. Lucky me. New hearing doctor didn't believe that I needed hypoallergenic molds made and ended up making regular ones to try them out. Within a few days, my left ear was sore. It hurt a lot more than usual. Doctor and ear specialist thought it was just a little bit of irritation and that it would clear up quickly. It ended up being a major middle inner ear infection. Ruptured the eardrum. Pus and blood everywhere on my pillow. About a month of agony, a lot of drugs, and a lot of specialists in the hospital. I was already very hard of hearing. That crap made me lose another 10 dB permanently. This isn't so much a faking it situation, but more of my ex-girlfriend having to deal with a really incompetent security guard that hindered her getting medical help. My ex had a severe peanut allergy and one time she ate a Thai chicken pizza in the college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air, because she was having trouble breathing. A security guard was passing outside in front of the building and saw that she might need some help. At this point my ex was panicking and frantically looking through her bag for her EpiPen. The security guard asked what was wrong and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. But when the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked her to hold out her arm, so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flow shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh, like you are supposed to, and sternly told her, "I need to get to a hospital now." For future notice to any allergy sufferers that have EpiPens, if anyone tries to take your EpiPen and play hero, kick them in the shin and do it yourself. Likely you have more experience and training with auto injectors than anyone else. When I was 9, I would get stomach aches when I went to school. My doctor insisted I was faking, but my mom insisted he take it seriously. Finally, they gave me a barium x-ray and saw I had a stomach ulcer. I had to take Maalox and drink milk at every meal and snack. I even had to get special permission to get milk from the cafeteria at morning recess. My teacher ridiculed me for that. She was horrible and abusive. While I never received any of her physical abuse, there were 2 other boys in my class who got it on a regular basis. This would have been 1980, so it wasn't normal for teachers to be pulling hair or knocking a kid's face into a desk. Every Friday, the 3 of us would have to stay after school while she told us all how stupid we were. My stomach aches did not get better, and the doctor accused me of some combination of faking, exaggerating, non-compliance. We literally had to save all the empty Maalox bottles to prove I really was taking my daily doses. Today we know that having me drink milk 6-7 times a day was exacerbating things. And in retrospect, my mom never really understood how stressful it was being in that class. It wasn't until the last few months of 4th grade, when they finally transferred me to another classroom, that I got well again. Later my mom told me that even she thought I'd been exaggerating when I talked about how mean the teacher was, because I'd left the honors class, moved down a level. My former teacher still ridiculed me pretty frequently when we crossed paths, but it didn't tie my stomach up in knots. Not me, but my mother. She had been very sick and tired. Imagine a cold, but it's 100x worse. The doctor she saw multiple times kept basically blowing it off, saying she just needed some rest. It kept getting worse. One day I was home with her. She was in bed sleeping and I was out in the living room watching TV. For some reason, she decided to walk out into the living room and sit in the chair across from the couch. She looked like a legit zombie, and when she sat down she could barely hold her head up. I immediately called 911. Turned out she had pneumonia and one of her lungs was entirely full of fluid, while the other was more than halfway. She spent a few days in the hospital and fully recovered. I don't know what made her decide to walk into the living room, but if she hadn't done that she likely would have died that day. All of that could have been avoided if the doctor she saw would have just paid closer attention to what was going on. Every time I've gone to her with anything, the first thing they do is a chest x-ray to check plus blood work to check everything else. In army training, going to sick call made you a shitbag, and trying to get out of training. Even doctors kinda brush off people cause they see so many, some who are actually faking it. So when I went in with bad back pain, the medic clearing me brushed me off and told me to go back to my company. Turned out my kidney was severely infected. I can barely remember this, but I was around the age of 11. I went for a sore throat, severe cough that would make me dry heave, phlegm, just the whole thing. Doctor says it's all in my head, despite me having an obviously inflamed throat and a very wet cough. I remember sitting there with my grandma, who was like, "Oh, I don't think it's in her head." I went back the same week and was diagnosed with walking pneumonia. I think that's when we switched doctors to LOL. I was 17 and had excruciating lower abdominal pain. Was sent home twice because I was young and it was probably just menstrual cramps. Third time I went to her, I happened to be on my period, so I told them I was also bleeding. Finally, the nurses passed me on to a doctor and gave me a scan ultrasound. Had an ovarian cyst the size of a golf ball. Ended up losing my ovary. I only have partial hearing in my left ear due to an idiot pediatrician. I was 15, I had an ear infection. Between dumb alcoholic mom swearing up and down that everything I did was for attention and this idiot who must have printed his diploma using Ms. Paint, I got no treatment. He didn't even look in my ear. It ruptured that night. Blood and pus everywhere over my pillow. A doc said I had the worst ear infection he'd ever seen. Broke my foot in 5 different places, but the scan only showed one little tear. They sent me home and were like, You will be back to normal in 6 weeks. 6 weeks later and my foot was still swollen and bruised and couldn't stand on it, so I went back. The doctor said, well, I can see on the old scan you had just one little tear. Maybe you need to try harder, but fine, we will do an MRI on your foot. Few days later I came back for the results. The doctor said, well, sometimes a regular scan can't see everything, and as we look at your foot here and here, you can see the broken bone fragments. It's already healing just fine, but this will take months to heal completely. No wonder you couldn't walk. I wasn't in that much pain, and if they saw the breaks at the scan I would have needed a cast for 6 weeks at least, so I don't really mind what happened. Not a doctor or nurse but a bunch of camp counselors and the infirmity doc. I went to a sleepaway camp for children with cancer, anything chronic and or life-threatening. It's the second day and I wake up feeling a little bit sick with a sore throat. Okay, I'll just drink some water and I'll be okay. It's the summer after all. I can't get sick. Breakfast rolls around at 10 AM and I'm not hungry and my throat is getting worse. I tell one of my counselors that I'm not feeling good and he says, eat something. Wait till after the morning activity. I couldn't bring myself to swallow and just sit there and then go to arts and crafts. I feel so sick at this point I just sit in the corner of the arts and crafts room, literally fading in and out. I tell a different counselor and he says, drink some water. I do. It doesn't help at all. I realize that they're not going to do anything unless I make a big deal about it. I think to stand up and make an announcement. When I stand up I immediately need to sit down again and now my throat hurts too much to talk. A third counselor walks up to me and asked me how I'm doing. I say, I don't feel good in my raspy weak voice. He says, wait until after this activity. Lunch comes around at 12:30 and I go to the bathroom before sitting down and I look like a zombie in the bathroom mirror. I go back to my table and say I can't eat. The counselors ask why. I say, I fell sick. One of the counselors begrudgingly agrees to take me to the infirmity, which was a mini hospital because all the kids here had medical issues. I can barely walk but I make it there, and promptly get sat down on an old wood bench and left alone as my counselor walks back to eat lunch. After about 15 minutes of waiting, a doctor pokes her head out of her office and asks me what's wrong. I tell her, I've felt sick since I woke up. My throat hurts. She feels my forehead and says you don't feel warm, but I'll get a thermometer. She comes back with a thermometer and puts it under my tongue. I had a fever of 102 and strep throat, at a tightly packed dining hall surrounded by kids with compromised immune systems. I'm surprised I didn't get anyone sick, but the fact that it took 5 hours to get a chronically sick kid some freaking medical attention still makes my blood boil. I was bedridden for 3 days and missed literally everything I wanted to do while there. The worst part was this was my last year before I got too old. I was losing my hair, my gums bled randomly, my skin looked like butt, my muscles cramped up randomly. I literally fell over once while standing on both my feet. I got horribly depressed. World felt like cardboard is the only way I can think to describe it, and all I wanted to do was eat and sleep. Sometimes I would start talking in conversation and get a word jumble midway through where words didn't come out right, which was the beginning of some social anxiety for me. I went to several doctors who plainly thought I was full of crap. Several of them asked me how much I drank, and one of them asked me over and over again as if he didn't believe me when I said I didn't. I was tested for low thyroid, cancer, rheumatoid arthritis and some other scary things, but nothing came up. This was over a 6-month period. I finally figured it out by googling my symptoms, which led me to a message board that suggested I find a doctor who would give me a blood test for it so I would know for sure. Turns out I was really low on B12. Somewhere in the low 300s I think. They went from nearly IRLing me to my face to giving me a B12 shot in the office before I left on my second visit and prescribing sublingual B12 to me. I actually found out a few years later that I have a gene mutation that keeps me from methylating B vitamins. I mention it to every new doctor I see now and they always look at me like I'm a hypochondriac. Then look it up on their laptop and kind of go okay like they're relieved I'm not full of crap. It took me a year and a half to find a doctor who tested me for B12 and gave me shots. Mentally it was really difficult to describe my state. I am so happy I never have to relive that again. Not exactly accused of faking it, more so just disbelieved or taken lightly. I went into emergency at the hospital because it was Saturday for a medium level abdominal pain that had been ongoing since the previous weekend. I'd been to the GP on Wednesday or Thursday and had a blood test booked for the coming Tuesday, earliest possible. However, my mum decided to take me in because of how long it had lasted without change. At the hospital I had a blood test taken and the doctor thought 50 milligrams of codeine would take care of my non-problem. It did nothing, so he gave another one and Panadol. He ended up believing and sending everyone frantic when I ended up bent over, frothing at the mouth and coughing up blood, and the blood test said pancreatitis. Several years ago I walked into traffic in a sort of vague dying would be nice kind of way. When I told my psychologist about this, he rightly had me carted off to the ER to be admitted into inpatient care. They shuffled me from room to room and eventually stuck me with this teenage girl who appeared to be having severe pregnancy complications. In the hall I could hear a woman screaming and vomiting violently. We sat there for hours. Finally the doctor came. By this point I was completely numb. She asked me questions. I answered. Do you have any plans for suicide? I'm not really the planning type. She finally said, well, you look fine to me, and sent me home. I bussed to my apartment and lay face down on my couch for several hours. I passed out walking to school, so my brother called an ambulance. Paramedics were hesitant the second time it happened and began asking if I was trying to get out of a test or if someone was messing with me at school. Turned out I had stage 3 colon cancer at 17. Glad you're okay now. Had an asthma attack once and a middle school nurse didn't believe me. Told me to get up and go back to class. Took 5 steps out the door and passed out. Woke up in a hospital with tubes being jammed in my nose and a mask over my face, oxygen and albuterol. And never was a claim about asthma ever not taken seriously ever again in that school district. Not really accused me of faking but misdiagnosed me. Had horrible loss of motivation and was so up and down with my emotions. I constantly slept and never felt rested even after sleeping for 10 hours. Doctor told me I was just depressed and put me on meds. They made me feel like a zombie and I couldn't concentrate, so I stopped taking them. A year later I went in for checkup with a different doctor and he found a lump on my thyroid. Turns out I have Hashimoto's, causing my hormones to go up and down constantly. Basically the other doctor was just putting a band-aid on symptoms and never bothered to find the underlying cause. Not exactly accused of faking it, but here's my story. One night I was working at this bar, and suddenly I'm overcome with an excruciating pain in my abdomen. Low left quadrant, just below my rib cage. I would rate the pain a solid 9. And the only reason I don't say 10 is because I've never been shot, stabbed, or anything like that. So I reserve my 10s for the really extreme stuff. But it was serious pain. The kind where I couldn't even carry a conversation. The pain backs off to about a 5, so I duck out of work, thinking I'll go home and see if it happens again. But on the way, it jumps back up to a 9 again, maybe a 9.5. I pull over at a gas station and call 911 because I can't drive and I don't know if I'm dying or what. I writhe in agony for 10-15 minutes while I wait for an ambulance, and wouldn't you freaking know it, the pain drops to a 0 the second they get there. The paramedics check me out, do an EKG, what have you. I'm fine. They take me to the triage nurse decides I'm fine, and I have to wait. When I finally see a doctor, it's this POF resident who's probably on hour 61 of her shift. By this time my mom and stepdad have arrived. The doctor has a thick accent, and my stepdad very casually asks her where the accent hails from, purely making small talk, no malice whatsoever. The lady gets all bent out of shape about it, like does it matter where I'm from? Anyway, from that point on, she's not listening to anything I'm saying. She asks me if I've had alcohol in the last 24 hours, and I say yes. I had a nightcap last night. She asks what's a nightcap. I told her it's a drink right before bed to help you sleep. I tell her I had one whiskey, and it's truly all I've had in the previous 24 hours. She finds the concept of a whiskey before bed baffling. She says she doesn't believe that's all I had to drink. She basically tells me I'm an alcoholic. I'm not, and that the pain was from drinking too much. and then she discharges me. I've never felt that pain before or since, and I have no clue what it was, but a crappy doctor chalked it up to a BS diagnosis, and that was that. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.